Surya Namaskar, Sun Salutation. Stand upright with feet closely aligned with each other. Take a deep breath. Expand your chest and relax your shoulders. While you inhale, raise your arms, and as you exhale, fold the hand in prayer position before your heart. Upon inhalation, lift your arms up and slightly lean backward. Ensure your biceps are close to your ears. As you exhale, bend forward at the hip and bring your arms downwards. Place the hands beside your feet. Make sure your knees are straight and spine is erect. Inhale. Extend your left leg behind as far as possible. Now fold your right knee and place it close towards the right part of the chest. Keep your hands on the floor and spread the fingers. Look up and bend your neck slightly backward. Breathe in. Stretch your right leg behind and bring your body into a straight line. Keep your body parallel to the floor. Slowly bring your knees to the floor and breathe out. Rest your chin, chest, hands, feet on the ground and raise your hips and abdomen high. Tuck your elbows to the side of your body. Press your palms into the mat and lift your chest and head off the ground. Rotate your shoulder blades away from the ears and arch your neck backward. Gaze in an upward direction. Elevate your hips up. Keep the heels on the ground and make an inverted V with your body. Inhale. Bring your left foot forward and place it between your hands and then rest your left knee on the ground. Look upward towards the ceiling. Gently bring your right foot next to your left foot. Keeping the position of your hands intact, lift your body upwards. Take a deep inhalation. Stretch your arms up overhead. Slightly arch your back. Try to stretch your body upward instead of backward and keep your biceps close to your ears. Exhale. Bring your arms down and stand upright in a relaxed manner. Slow pace helps to make body flexible. Medium pace helps to tone the muscles. Fast pace is excellent cardiovascular workout and also helps in weight loss. At the end of the sequence, it is advisable to lie down for a few minutes on your back. With fever, it is not advisable to perform the sun salutation. Do not overdo it. Breathing should always be done through the nose. If you see that you need to breathe through your mouth, it's time to stop. Do it slowly, especially at the beginning, so that you can control the frequency of breathing and the heartbeat. Practice awareness in each position. How you feel, how your breathing is, what difficulties you are in. If you are pregnant, do not perform the classic sun salutation postures. The best time is in the morning or at night, but always on an empty stomach or digestion. Sun salutation forms an excellent link as a warm-up before other yoga asanas. The asanas in a Surya Namaskar put pressure on the pancreas in a good way, thus stimulating it to maintain an optimum level of insulin, making this a good exercise for anyone who is pre-diabetic or diabetic. Strengthen the entire digestive system, including stomach, pancreas, intestines, liver, etc., and cures and prevents constipation. Invigorates the nervous system, including the brain, spinal cord, lower plexus, and cures brain fag, forgetfulness, worries, and other forms of mental derangement. Invigorates the heart and will cure and prevent blood pressure, palpitation. Develops the lungs, gives you wind and prevent tuberculosis. Improves the quality and circulation of the blood. Stimulates glandular activity, gives a new vivacity to the glands. Improves the color and function of the spleen by enabling it to eradicate toxic impurities through profuse perspiration and to absorb vital energy from the atmosphere. Strengthens the neck, shoulder, arms, wrists, fingers, back, stomach, waist, abdomen, intestines, thighs, knees, calves, and ankles. Strengthening the back is known to be a simple but efficient remedy for kidney troubles. Improves the uterus and ovaries, remove menstrual disorders such as dysmenorrhea and consequent pain and misery. Childbearing is less painful and more easy. All discomforts from menopause vanish. Will rid women of morning sickness and perverted taste and appetite, peculiar to pregnant women and regarded as inevitable. Increase the quantity and improves the quality of milk in nursing mothers. Proven to halt falling of hair and its tendency to grayness and prevents baldness by increasing nutrition to the hair and scalp. Eradicates sexual debility and the special weakness of men and women. Reduces redundant fat, especially the fat about the abdomen, hips, thighs, neck, and chin. Will remove kidney troubles, strengthens the stomach, neck, back, and chest, reduces the abdominal prominence of the Adam's apple, destroys the offensive odor of perspiration, reduces bow-leggedness, improves knock knees in walking, prevents and corrects neurasthenia, will increase the height of the body, will produce direct mechanical effect upon the alimentary canal and will prevent and cure constipation, makes you immune from disease by tremendously increasing your disease-resisting power. Sirsasana, headstand. Sit on soles, place knees on the ground. Making a triangle from finger lock and elbows, bending forward, place middle of the head on the ground near finger lock. Slowly bring the legs near your body. Soles will automatically leave the ground by practice. Completely balance your body on head. While returning to the original position, fold your knee first, then fold your legs from thigh and let the thigh and knee touch your abdomen. Now slowly place the soles on the ground. Slowly raise your head also and sit on soles. While practicing Sirsasana, place that part of your head on the ground on which the spine can remain erect. Do not raise your legs with a jerk. Slow and gradual practice will raise your legs up automatically. In the beginning, practice it under the guidance of a teacher because there is a fear of falling down. While returning, do not raise your head soon after completing asana. There remains a fear of getting giddiness. Therefore, keep your head near finger lock for some time and then raise it up. Those suffering from high blood pressure, running ear, or heart disease should not practice it. Those having cough or chronic cold also should not practice it. Person suffering from constipation should practice it carefully. A person suffering from high blood pressure, heart malfunctioning, cerebral or coronary thrombosis, arteriosclerosis, conjunctivitis, and chronic glaucoma, blood hemorrhage in the head, chronic cataract, slipped disc, and kidney problems should not practice Sirsasana. Sirsasana should be immediately stopped if you experience a headache, feel dizziness, perspire profusely, become very hot, have palpitation of the heart. The pose has a significant positive influence in relieving diabetes. It acts directly on the pituitary gland by improving the blood supply, thus has been great help in combating diabetes. This increases the blood circulation in head and memory power is improved. This strengthens the nervous center of the whole body and maintains the health of endocrine gland. Digestive system is also benefited through this asana. It is beneficial against congested throat, disease of liver and spleen, and envisceroptosis. It induces calmness, thus prevents headache and migraine. It is extremely beneficial in combating sexual disorders such as prostate problems, hydrocele, leukorrhea, spermatoria, and all general menopausal and menstrual ailments. It acts upon the thyroid gland and helps to balance the metabolic functions. It improves the function of sensory organ by ensuring adequate supply of blood to these organs. The conditions like myopia, astigmatism, and cataract, and general bad hearing are found to be improved by regular practice of it. It allows an oxygen-rich flow of blood to the facial skin, thus improves the facial complexion. It is good to prevent hair fall, baldness, and graying of hair by supplying enriched blood and nutrients to the scalp region. People suffering from loss of sleep, memory, and vitality have recovered by the regular practice of this asana. It relieves from colds, coughs, tonsillitis, halitosis, and palpitations. RBC formation also increased after the regular practice of it. Veerasana, hero pose. Kneel on your mat with your knees together and thighs perpendicular to the floor. Separate your feet slightly wider than hip wide. Point your toes straight back. Bend your knees a bit. Lean forward and place your hands on your calves. Lower your buttocks and sit on the floor. The inner sides of your calves should touch your outer thighs. Place your hands on your knees. Extend your arms straight in front of you. Bring your palms together and interlock your fingers. Now turn your palms forward. Inhale and raise your arms overhead. To come out of this pose, lower your arms, place your hands on the floor, and lift your buttocks. Raise one knee at a time, sliding each foot forward to straighten your leg. People suffering from any kind of knee weakness or knee injury should not practice this asana. If you suffer from any of this condition, avoid practicing this asana. Arthritis, spinal disorders, osteoarthritis, high blood pressure, respiratory diseases, or any heart disease. Balances the mind and improves the concentration power. Helpful in stabilizing the functioning of the whole nervous system. Highly beneficial for the liver, kidney, and all other abdominal organs. It stretches thighs, knees, ankles, and feet. Virasana improves blood circulation in legs. It improves digestion. Beneficial in gas problems. cures the symptoms of menopause, improves your posture. During pregnancy, it helps to reduce swelling of the legs through second trimester. Useful in asthma and high blood pressure. Mayurasana, Peacock pose. Sit on both your upper soles. Knees should be placed on the ground. Stretch out fingers of your hands and place the palms on the ground. Fingers will remain stretched, pointing backwards. Place elbows gently on either side of the navel. Slowly stretching both legs together. Keep straight your chest, neck, and head also. Maintain it for some time, then return to the original position. Slowly fold your legs and place the knees on the ground. Full weight of your body remain on the navel, and it is possible to lose the balance at any moment. Hence, practice it with care. Jerk should be avoided at any stage. If during practice you feel like coughing or sneezing, then return and start practicing again. Those suffering from cervical spondylitis should not practice it. It is best to avoid this asana if you have an injury in your wrist, shoulder, or elbow. Avoid this asana in case you have the following conditions: heart diseases, hernia, high blood pressure, eye, ear, and nose infections, problem in the intestine, brain tumor, menstruation, pregnancy. This asana is said to detoxify your system and release toxins. If you feel unwell during the pose, release the asana immediately. Peacock pose is beneficial in piles and diabetes. This asana is a very good measure against visceroptosis and dyspepsia. Peacock pose removes toxins and detoxifies your body, improves the function of digestive system and makes abdomen stronger, strengthens and tones your reproductive system. Mayurasana improves sexual activity, makes your elbow, wrist, spine and shoulders stronger. Mayurasana improves your posture, reduces anxiety and stress, and gives calmness to the mind. Increases your focusing power in the mind. Paschimottanasana, the seated forward bend. Sit stretching both the legs together in front, hands by the side, palms resting on the ground. Fingers should remain together, pointing forward. Loosen your back muscles and bend the body forward as far as it is possible. Maintaining this pose, loosen your hands and place them where they are comfortable. It would be better if they are put on the thighs. Practice it daily and keep bending forward a little more. Finally, hold the big toes of the legs with 4 fingers of respective hand and place forehead on the knees. After a few seconds, raise the head, release the big toes, and come to the original position. Your aim is to hold the toes by bending forward slowly and to place the forehead on the knees. Therefore, do not make haste. Do not force to reach the final position on very first day if it is found difficult. Know your limitations and accordingly increase bending forward daily. Never fold the legs at the knees whether you can bend forward or not. Those suffering from chronic constipation should not practice it for more than 3 minutes daily. Those suffering from ulcer in abdomen should not practice it. Person suffering from back problem, asthma, sciatica, slip disc, and hernia and diarrhea should avoid practice of Paschimottanasana. If any surgery is done, then avoid practicing Paschimottanasana. It provides adequate massage to pancreas and forces the endocrine gland to release insulin, thus ensures in the prevention and management of diabetes. It strengthens abdominal muscles. It removes constipation, dyspepsia, and seminal weakness. It removes the possibility of sciatica. It is much useful asana for increasing height. It works as most beneficial exercise for the working liver, kidneys, uterus, pancreas, spleen, adrenal glands, and gonad glands and ovaries. It reduces obesity, removes many ailments, and increases appetite. Gives a good stretch to the spinal column, hamstring muscle, and is beneficial for the heart. Helpful in curing impotency in males. Vrksasana, tree pose. Stand erect with legs together, hands by the side of thigh, gaze in front. Fold your right leg at the knee and place the side near the left thigh joint. Bring both the hands in Namaskar mudra. After maintaining it for some time, release your hands and stand on both the feet. Now practice similarly from the other leg. This completes one round of Vrksasana. Stand erect. Folded knee should point toward their respective sides. This is a balancing pose. If you feel like losing your balance, then come back and practice again. Avoid practicing Vrksasana in case you suffer from any of these conditions: vertigo, low blood pressure, knee or ankle pain, insomnia, dizziness, or a migraine. In case of high blood pressure, do not raise arms overhead. Those having complaint of reeling sensation should not practice it. Those with knee or hip injury should not practice it. This improves body-minded coordination, relieves sciatica, and reduces flat feet. It helps to cure rheumatic pain and also treats numbness. Helps to relieve from the mild pain in the lower back area. Stretches the chest, shoulders, groins, and inner thighs. Opens the hips. Strengthens calves, ankles, spine, and thighs. Improves the concentration and focus. Helps to lengthen the spine. Virabhadrasana I and II. Warrior pose I and II. Stand with your feet together, with your arms alongside your body. Turn your biceps and palms to face forward. With an exhale, step or lightly jump your feet 3.5 to 4 feet apart. Raise your arms perpendicular to the floor and parallel to each other, and reach actively through the little finger sides of the hands toward the ceiling. Firm your scapulas against your back and draw them down toward the coccyx. Turn your left foot in 45 to 60 degrees to the right and your right foot out 90 degrees to the right. Align the right heel with the left heel. Exhale and rotate your torso to the right, squaring the front of your pelvis as much as possible with the front edge of your mat. As the left hip point turns forward, press the head of the left femur back to ground the heel. Lengthen your coccyx towards the floor and arch your upper torso back slightly. With your left heel firmly anchored to the floor, exhale and bend your right knee over the right ankle so the shin is perpendicular to the floor. More flexible people should align their right thigh parallel to the floor. Reach strongly through your arms, lifting the rib cage away from the pelvis. As you ground down through the back foot, feel a lift that runs up the back leg, across the belly and chest, and up into the arms. If possible, bring the palms together. Spread the palms against each other and reach a little higher through the pinky side of the hands. Keep your head in a neutral position, gazing forward, or tilt it back and look up at your thumbs. Stay for 30 seconds to a minute. To come up, inhale, press the back heel firmly into the floor and reach up through the arms, straightening the right knee. Turn the feet forward and release the arms with an exhalation, or keep them extended upward for more challenge. Take a few breaths, then turn the feet to the left and repeat the same length. When you are finished, return to the first position. Stand with your feet together, with your arms alongside your body. Turn your biceps and palms to face forward. With an exhalation, step or lightly jump your feet 3.5 to 4 feet apart. Raise your arms parallel to the floor and reach them actively out to the sides. Shoulder blades wide, palms down. Turn your right foot slightly to the right and your left foot out to the left 90 degrees. Align the left heel with the right heel. Firm your thighs and turn your left thigh outwards so that the center of the left kneecap is in line with the center of the left ankle. Exhale and bend your left knee over the left ankle so that the shin is perpendicular to the floor. If possible, bring the left thigh parallel to the floor. Anchor this movement of the left knee by strengthening the right leg and pressing the outer right heel firmly to the floor. Stretch the arms away from the space between the shoulder blades, parallel to the floor. Don't lean the torso over the left thigh. Keep the sides of the torso equally long and the shoulders directly over the pelvis. Press the tailbone slightly towards the pubis. Turn the head to the left and look out over the fingers. Stay for 30 seconds to 1 minute. Inhale to come up. Reverse the feet and repeat for the same length of time to the left. In a Virabhadrasana I, do not practice if suffering from following: high blood pressure, heart problems. Those with shoulder problems should keep their raised arm parallel or slightly wider than parallel to each other. Those with neck problems should keep their head in a neutral position and not look up at the hands. In Virabhadrasana II, do not practice if suffering from following: diarrhea, high blood pressure. Those with neck problems should not turn your head to look over the front hand. Continue to look straight ahead with both sides of the neck lengthened evenly. This asana is known to strengthen and tone the lower back, the arms, and the legs. It helps to stabilize and balance the body as it increases the stamina. It is also a great asana for those with desk or sedentary jobs. It stimulates the metabolism as well as restores the spine. This asana helps ease out frozen shoulders. It also helps release stress from the shoulders almost immediately. This asana relaxes the mind and the body, spreading the notion of peace, courage, grace, and a sense of auspiciousness. Strengthen and stretches the legs and ankles. Stretches the groins, chest, and lungs, shoulders. Stimulates abdominal organs. Increases stamina. Relieves backaches, especially through second trimester of pregnancy. Therapeutic for carpal tunnel syndrome, flat feet, infertility, osteoporosis, and sciatica. This posture benefits pregnant women who are in their second and third trimesters. However, they must consult with a doctor before doing this posture. They can also stand close to the wall to support themselves while practicing this pose. Utthita Parsvakonasana, extended side angle. Stand with your feet together, with your arms alongside your body. Turn your biceps and palms to face forward. On an exhalation, step your feet 3 to 4 feet apart. If you feel as though your feet are slipping, shorten your stance slightly. If your legs are too far apart, it's difficult to find stability. As you gain flexibility, you can widen your stance. Rest your hands on your hips. Turn your right foot out so that your toes face the front of your mat. Turn your left foot slightly in. Align your right heel with your left heel. Engage your quadricep muscle by lifting your kneecaps towards your thighs. Bend your right knee to bring your right shin and thigh to a 90-degree angle with your right kneecap in line with your right ankle. On an inhalation, extend your arms out to your sides. Then reach them up overhead and lengthen through your sides. Allow your pelvis to shift. Rotate your left hip slightly forward and shift your right hip back as you begin to fold to the right. Keep your torso and spine long as you side bend. Place your right hand to the outside of your right foot. Sweep and extend your left arm over your left ear, maintaining a straight line from your left foot all the way up to your left fingertips. Your palm should be facing down. Attempt to widen your collarbones to create space between your left shoulder and left ear. Press through your outer left foot. Keep your head neutral or turn it to gaze at your left thumb. Hold here for 5 to 10 breaths. Repeat on the other side. In case you have a neck problem, do not look at the extended arm. Look straight or down instead. Avoid this asana if you have the following conditions: frequent headaches, high or low blood pressure, migraine, insomnia, joint pain, cervical spondylitis, or heart problem. It not only stretches but also strengthens the knees, ankles, and the legs. The groin, chest, spine, waist, lungs, and shoulders get a good stretch. The abdominal organs are stimulated. Stamina is increased. This asana also gives therapeutic relief for constipation, infertility, lower back aches, osteoporosis, sciatica, and menstrual discomfort. Setu Bandha Sarvangasana, bridge pose. Lie on your back with your knees bent, feet flat, hip width apart, heels directly below your knees. Leave your upper arms on the floor and bend your elbows alongside your ribs, pointing your forearms and fingers towards the ceiling. Turn your palms to face one another. Press your elbows and shoulder heads down into the floor. Lift your chest and bring your shoulder blades onto your upper back, wrapping your outer arms towards the floor. Keep your gaze straight up. Press into your feet and slowly send your knees forward, wrapping your outer hip towards the ceiling. Then lift your buttock away from the floor. Lengthen your tailbone towards the backs of your knees. Straighten your elbows and interlace your fingers underneath you, drawing your shoulder blades deeper into your upper back, keeping the tops of your shoulders in line with the base of your neck. Gently press the center of the back of your head into the floor. Broaden your collarbones and lift your chest, bringing your sternum towards your chin. Lightly reach your chin away from the chest, keeping space between the back of your neck and the floor. Simultaneously extend out through your knees as you lift your sternum. Take a few rounds of breath here. To release, unlace your fingers and slowly lower your torso back to the floor. One shouldn't perform this pose if suffering from neck pain. In back injury, it should be avoided. Skip the yoga pose if one having knee pain. Avoid it during shoulder injury. Avoid turning your head right or left while you are in pose. Stretches the chest, neck, spine, and hips. Strengthens the back, buttock, and hamstrings. Improves circulation of blood. Helps alleviate stress and mild depression. Calms the brain and central nervous system. Stimulates the lungs, thyroid glands, and abdominal organs. Improves digestion. Helps relieve symptoms of menopause. Reduces backache and headache. Reduces fatigue, anxiety, and insomnia. Rejuvenates tired legs. Relieves symptoms of asthma and high blood pressure. Therapeutic for hypertension, osteoporosis, and sinusitis. Helpful in treatment of tennis elbow. Jathara Parivartanasana, Alligator twist. Lie on your back with your knees drawn into your chest. Inhale and exhale several times to lengthen the connective tissues in your lower back. Set your arms out to your sides at the shoulder level. Palms turned up. On an exhale, sweep your knees right and draw them towards your right elbow. Actively stretch your left arm in opposition to your legs to provide a counterpoint to the twist. At the same time, ground your left shoulder blade. With each exhalation, revolve your abdomen to the left, away from your knees. Keep your low back energized by actively drawing your lumbar spine inward to stabilize your core and deepen the twist. Feel how your skin, connective tissue, organ, and spine rotate with each breath. Stay for 30 seconds before actively swinging your knee back up to the center. Repeat on the left. Make sure that you do not let your knees to shift below your pelvis. This will put a strain on the lumbar vertebrae. Make sure that your arms and shoulder blades are touching the ground all the time while practicing Jathara Parivartanasana. If your arms and shoulder blades are lifted, this will put a strain on the upper back, neck, and shoulders. People suffering from any injury in the back, knees, and hips should not practice this yoga pose. People who have had any surgery of knees, spine, hips, or back recently should also make sure that you do not let your knees to shift below your pelvis. This will put a strain on the lumbar vertebrae. Make sure that your arms and shoulder blades are touching the ground all the time while practicing Jathara Parivartanasana. If your arms and shoulder blades are lifted, this will put a strain on the upper back, neck, and shoulders. People suffering from any injury in the back, knees, and hips should not practice this yoga pose. People who have had any surgery of knees, spine, hips, or back recently should also not practice the Jathara Parivartanasana until they are completely healed. People suffering from hiatal hernia are not supposed to practice Jathara Parivartanasana. People with a very weak sacroiliac joint are also not supposed to practice this exercise pose. Jathara Parivartanasana should not be practiced by people suffering from gastroesophageal reflux disease. Get out of the pose or release the pose if you feel a sudden sharp and shooting pain in your legs or abdomen. If you have any doubts about your condition, consult a physician before practicing Jathara Parivartanasana, and always practice asana under the supervision of a trained yoga expert. Do not overexert yourself while practicing Jathara Parivartanasana. Do not push yourself beyond the limits. Go only as far as your body allows. It tones the digestive system and helps in relieving constipation with regular practice. It also improves the functioning of the reproductive system. It strengthens the supporting muscle and tissues, resulting in more efficient, balanced structural alignment and improves the posture. It also improves physiological functioning of the human body. It is beneficial in improving blood circulation throughout the abdominal area. It is also a relaxation pose which eases you and makes you feel refreshed if practiced after a very tiring day of work. When practiced regularly, it helps in relieving stress and energizes the whole body. It calms the nerves, alleviates stress, and helps in getting rid of the mild depression. It massages the abdominal organs and stimulates the digestive system, thereby improving digestion. It stretches and strengthens the hips, lower back, and spine. With regular practice, it is beneficial in making the spine flexible. It is said to hydrate the vertebral discs and open the rib cage to promote deeper breathing. It increases the body metabolism and helps in releasing toxins from the body. It is also beneficial for people suffering from frequent headaches and migraine. Shavasana, relaxation pose. Lie straight on your back with ease. Make distance of about 1.5 feet between legs. Place hands straight on the ground at a distance of 6 inches from your body. Palms facing upwards, fingers will remain slightly curled, eyes closed. After maintaining it for some time, return. There must not be tension in any part of your body. Release the tension by shaking that part where you're feeling tension. Loosen your legs and hands completely. Loosen palms and fingers also. Concentrate on your breathing pattern. Try to feel and concentrate on warmth while exhaling and on coolness while inhaling in the nostrils. If this is not possible in the beginning, then bulge your abdomen as you inhale and carry the abdomen downward while exhaling and concentrate on this movement of the abdomen. This asana is practiced soon after the practice of other asanas. Through this, fatigue is removed. This is very beneficial in high blood pressure and cardiac diseases. This asana is very beneficial for the people suffering from neurosis and fear complexes. Those who have been forbidden for supine position by doctors due to some reason should not practice it.